Good evening. My name is Sanjay Reed, ENT attached to the Nickel Fire Station, and today I'll be doing a brief presentation on shock, and I'll speak a little about what shock is, the different types of shock, and how to manage shock. Now, after doing this presentation, you, my viewers, will have a better understanding of what shock is, right? Now, shock is basically hypoperfusion, and this is a life-threatening condition where there is inadequate delivery of oxygen and nutrients to the tissues of the body, leading to organ failure and death if it is left untreated. Now, adequate perfusion is the opposite, and that is basically the supply of sufficient oxygenated blood to body tissues and the removal of waste. Right now, in order for adequate perfusion to occur in the body, it depends primarily on three important factors. Now, we will speak on this, and these three factors make up what we call the perfusion triangle. And if one is in problem, then hypoperfusion will be inevitable. Now, first we'll speak about the pump, and the pump is basically the heart. And if the heart is not pumping blood effectively throughout the body, now that is going to be a problem, right? Secondly, we'll talk about the container. The container is basically the blood vessels, and if the blood vessels aren't constricting or dilating where necessary, then that is also going to be a problem, right? Thirdly, I'll speak about the content, and the content have to do with the body fluid, the blood volume, right? And in adult, the average blood volume is 6 liters, and that's about 12 points of blood, right? All right, so I'll go further and speak about the different phases of shock, and we have three phases which I'll delve into right now. And the first phase is the compensatory phase, right? And this is the early stage, right, where you have what we call tachycardia, right, and vasoconstriction, right? So signs and symptoms of this is restlessness and anxiety, pale or cool or clammy skin. Blood pressure in a lot of cases will be normal. All right. For the decompensated phase, which is the second phase I'll talk about, right, is when the compensatory mechanism actually fails or perfusion worsens, right? So the signs and symptoms of this is a fall in blood pressure, right? Weak or absent pulse, confusion, shallow or rapid breathing, or mottled skin, right? So, and the third phase now is the irreversible phase, and which is the final stage. And even if treatment is administered to a patient in this phase, death is imminent. All right, and some of the signs are unconsciousness, very low or absent blood pressure, right? Weak pulse or agonal respiration. So I'll now talk about the different types of shock, right? And I'll speak about the content. And the content, as mentioned earlier, have to do with the blood volume or the body fluids. So I'll speak now about the hypovolemic shock. And some of the causes of this is, for example, a hemorrhage or dehydration or burns, right? And signs and symptoms are tachycardia, which is the elevated heart rate, weak pulse, pale, cool or clammy skin, thirst, low blood pressure. Yes, that's in the late stage. And the management of this is, for example, control bleeding, have the person supine and administer oxygen, keep the person warm, and rapid transport, right? So for the second one is we talk about now the pump, and if the pump is not working effectively now, this is also going to be a problem. So one of the shock I'll speak about under the pump is the cardiogenic shock, and some of the common cause of cardiogenic shock is, for example, a myocardial infarction, right, or congestive heart failure. Yes, and some of the signs and symptoms are chest pain, irregular pulse, hypotension, cyanosis, and difficulty breathing. And how do we manage a patient in such a case? Yes, we have to manage the airway. Assist ventilation is imperative. Position of comfort, example in a semi-sitting position, just to relieve respiratory distress. Rapid transport is also imperative. All right, so we speak more about pump failure as well. So we speak now on obstructive shock, right? And this is caused by physical obstruction, for example, a pneumothorax or a cardiac tamponade. Too much fluid is on the heart, which prevent it from pumping effectively. A pulmonary embolism, or a clot that breaks off from somewhere else and lodges in a blood vessel, prevent the heart from working properly. All right, signs and symptoms are severe shortness of breath, jugular vein distension, and for example, you have trachea deviation, muffled heart sound, chest pain. How do we manage a case like this? Oxygen therapy, support breathing, rapid transport. Yes. Right, so the next one we'll talk about is the container, which is the blood vessel, as made mention. And under this type of shock, we have the distributive shock, right? And we speak about, for example, septic shock, and this is a severe infection. And signs of this are, for example, high temperature, warm skin in early stages, right? Low blood pressure, tachycardia, management, rapid transport, and oxygen, right? Secondly, we have neurogenic shock, right? And this is issues with the spinal cord. And signs and symptoms are dry skin, hypotension, bradycardia, right, which is low heart rate, and paralysis, right? Management is to maintain C-spine immobilization, administer oxygen, and keep the patient warm. Thirdly, we talk about now is anaphylactic shock, which is a severe allergic reaction. For example, you might get a bee sting, or you eat some peanuts, something that the body is allergic to. Some of the signs of severe reaction or anaphylactic shock is, for example, flushed skin, hives, urticaria, stridor, hypertension, wheezing, right? How do we manage a case like this? Oxygen is imperative. Assist with, for example, an epinephrine or antihistamine, and rapid transport. All right. So those are basically the shocks that I'll be expounding on, and that is my brief presentation. I thank you.